I'm Dr. Maunika SC from SPARSH Infantry Road, and the topics today we'll be discussing about heart attack, the heart failure, the treatments for it, and the surgery part. And here we have Dr. Chirag, consultant cardiologist, and Dr. Ashok Kumar, consultant cardiologist, and Dr. Rohit, consultant cardiac surgeon. So Dr. Chirag, what is the difference between a cardiac arrest and a heart attack?
So heart attack is a condition which develops when one or more of the arteries which supply blood to the heart muscle develop a clot, and as a result of this, the muscle which is supplied by that particular artery undergoes damage. The patient typically experiences chest pain or in advanced stages some breathing difficulty, and they present to the hospital. When we say cardiac arrest, basically what we mean is the heart has stopped functioning, and here the patient typically present with sudden collapse. And the most common cause for cardiac arrest is arrhythmia, which arises out of heart attack. The other reason for cardiac arrest typically is somebody who is predisposed to develop some electrical abnormalities, and these people also can present with abnormal heart rhythms, which results in cardiac arrest.
So what are the common risk factors for the heart attack, sir?
So the common risk factors for heart attack are the conventional risk factors like diabetes, hypertension, smoking, high cholesterol levels, and also a family history of heart disease. And also now we are seeing more common in younger individuals also. So it is not that only heart attack affects elderly patients. So heart attack can be seen across a spectrum of age group. The common conventional risk factors like diabetes, hypertension, smoking, and bad cholesterol levels and obesity should be kept in mind.
So what are the typical symptoms of this heart attack, sir? And how do you get to know the crucial things when the patient has to come to you?
So the typical symptom for heart attack is usually chest pain. It may not be pain every time. Some people present with heaviness, which is predominantly around the precordium, which is the central aspect of the chest. Some people do have other symptoms associated with that, like back pain, sweating, or pain radiating to the jaw or the left hand pain. In females and elderly patients, these symptoms may not be there, and they may experience unusual symptoms like fatigue, extreme tiredness, and unable to do anything. So these are the typical symptoms. So when is the crucial time and what to do for diagnosis? The simple steps are to do an ECG, echo, and a blood test called troponin, which in most conditions will be able to diagnose if there is a heart attack or not. So if a heart attack has to be diagnosed, the treatment outcomes are best when it is treated early. Typically, if it is treated within the first 6 to 12 hours, the outcomes are the best. And beyond 24 hours, outcomes are not so great.
So what are the diagnostic tests you do to a patient to recognize or to check for the heart attack?
So the diagnostic tests, as we mentioned, are the ECG and echo. And if already these tests show that there are abnormalities, then we straight away diagnose that there is a heart attack. If these tests are normal, sometimes early in the presentation these tests may be normal also. We do repeat them after an interval period of 3 hours or so that we don't miss a diagnosis of heart attack. And also there's a blood test called troponin, which is an enzyme which is very specific for the heart, and it gets released in the blood only when there is a heart attack. So that test will also help us to diagnose the heart attack. So once we have diagnosed the heart attack, the next confirmatory diagnosis is to understand where the block is and treat it so the heart attack can be treated completely. So in that condition, what we do is we recommend an angiogram, wherein we pass a catheter into the heart and inject dye in the coronary arteries to understand where the block is and what is the severity of the block. And depending upon that, we decide on what treatment strategy to be started.
So what are the treatment options available for a person who is suffering from a heart attack, sir?
Once we do the angiogram, as we discussed, and once we have diagnosed the amount of blockage and where is the blockage, the first treatment option is to do an angioplasty, especially of the culprit block, means the artery which is causing the heart attack. So if there are any blocks which are there in the other arteries where the block which is not a culprit artery, that can be treated at a later stage. The first step would be to identify which is the culprit which is causing the heart attack and treat that culprit artery typically with a angioplasty, wherein we do a ballooning and then followed by a stent in majority of the situations. In some situations, a patient may be having extensive blocks, then we consider to do angioplasty first, followed by a staged angioplasty, or followed by a staged surgery in the form of coronary artery bypass grafting.